3, 2, 1.
Okay, greetings and welcome. So today we're going to be talking about the future of medicine. We're going to be discussing what changes are we expecting to see in the medical field, and I've summarized most of the changes that we're expecting to see into 6 main points. The first point I've called it preventing rather than treating. Then the second point I've called it preventive medicine. The third point, I've called it investigative assessment or intensive assessment. Then the fourth point, I've called it all hands on board approach. Then the fifth point, I've called it the digital age. Then the sixth point, I've called it the specialization era. So those are the points that we are mainly going to be discussing, and those are also the changes that we shall see in the future. Okay, so let's discuss the first point. More efforts spent on prevention rather than treatment. Prevention of future pandemics and all diseases in general shall be at the forefront of medicine. More information on causes of diseases and medical conditions is being gathered every day. This means that if only we can work on those and limit our probability of interacting with them, prevention of a lot of diseases is inevitable. If not, then the cases of the diseases shall be greatly reduced. We have already seen such methods being used in the past. For example, when the Black Death pandemic happened, the discovery of the pathogen that caused Black Death and its study largely contributed to both the reduction of the cases of the pandemic and was material in informing people how to go around about it. The COVID-19 can also be a perfect example, as we saw the first thing that scientists did after reports of the COVID-19 cases was to find the virus that causes the diseases and its transmission methods. Then education was done on the population, and it has contributed to the prevention and limitation of the cases of COVID-19 today. However, pathogens that are transmitted through the respiratory system are a bit difficult to control, especially with the large populations that we have now in the cities and in towns, and more so in the future when the cities and the towns and the urban population shall continue to grow. This takes us to another issue, which is vaccination. Vaccination shall be also used uh, greatly in the future because it is the current method that is proved to be very, very effective in the treatment, both in treatment and prevention of transmittable diseases. We shall also see a rise in the number of people who are willing to be vaccinated, both in small children and in adults. Adjusting lifestyles to move in line with the changing world shall also be the most effective method, which is also natural to prevent diseases. And you are going to see the future medicine advising a lot about adjustments of lifestyles. We are also likely to see the banning of certain foodstuffs and chemicals that shall prove to cause or promote certain diseases like cancer and tumors. More people shall also join the habit of frequent medical checkups, and in this way, we get the advice from doctors on how to go about diseases that we are likely to suffer from. In order to limit the cases of babies born with certain medical conditions or genetically acquired diseases, assessment of the genetic makeups and physique of unborn children shall greatly increase, and the application of genetic technology to correct such conditions shall also be used. This shall be of great help to the limitation of diseases such as the Down syndrome, congenital heart disease, the CDH, etc. And these diseases have already started to benefit from this and shall greatly reduce in the future, among other diseases. So the second issue is the issue of preventive medicine, and just check on the picture that is on the screen for the definition of preventive medicine. So medicine is now drifting towards the study of DNA to discover underlying conditions and diseases such as may be from mutation, presence of certain genes, etc. Genetic study shall also be very useful and greatly applied in tracing family-running diseases and correct them at very early stages. Some genetic diseases that can be corrected in this manner may include cystic fibrosis, Down syndrome, sickle cell anemia, Tay-Sachs disease, Huntington disease, Marfan syndrome, and hemochromatosis. Pregnant mothers may also get advised on the genetic makeups of their unborn babies and the implications, if any, of giving birth to the conceived baby. It has already been proved that people with certain genes are likely to get certain diseases more than others. For example, the presence of the gene BRCA2 can be linked with certain diseases. Therefore, such people will be helped before the related disease manifests. So this in general shall be what preventing medicine shall be focusing on, and in order to push the issue of prevention rather than treatment, this kind of medicine shall be greatly applied. The third point is the treatment of a patient based on an intensive assessment of his situation, which necessitates treatment of the root cause, not silencing the symptoms. Medicine is now drifting towards an investigative treatment approach where the practitioner will be more focused on the root cause and the root problem to a certain medical condition rather than the surface expression of that condition. In the past, we have seen a lot of patients given painkillers only and such medicine without them knowing the actual problem. This, however, requires to work hand in hand with physiological research so that the correct conclusions and correct treatments, which are long lasting, are then applied. To date, a lot of study is being done on this pathogens, including normal microbiota, which are the organisms that are normally found in every human and do not cause diseases as long as their balance and positions are maintained. However, study has shown that if this balance is disturbed or this normal microbiota changes its position within the human body, then it is going to cause certain diseases. Other pathogens from outside the body are also still being studied, and this shall promote the correct and full treatment of a lot of diseases in the future. Since we now have internet platforms and the all hands on board approach is becoming popular, some repetitive cases may also be solved using methods that were applied elsewhere in the world by different practitioners, and special challenging cases may then be referred to specialists in a particular field for further research. So point number 4 is the all hands on board approach, which talks about people now appreciating the significance of medicine, and all hands are now on the deck with the medical practitioners to both prevent and treat diseases. In future, the people shall trust more in medicine, shifting from the other traditional and religious beliefs that were contrary to the practice of medicine in the past. This can be demonstrated by the large resistance that people recently had on the COVID-19 tests and vaccinations. This, however, is getting lower as the people are witnessing the effectiveness of vaccines. Due to the various pandemics and challenging medical cases like cancer, COVID-19, TB, etc., people have since started to closely rely on medical advice to maneuver around them. It is a fact that in the future we are going to have more frequent pandemics than ever, and we shall need to rely strongly on the medical sector for advice. The pattern of reliance on medical advice shall grow in the future, especially in regions like Africa, where some people and certain tribes are against maternity hospitals and other forms of medical institutions, and they teach pregnant mothers to give birth at home under the watch of the so-called experienced helpers. They also trust a lot in witch doctors and the locally found herbs for treatment, and this has claimed a lot of lives and cannot be applied in cases like accident injuries, COVID-19, cancers, etc. Recently, and more so in the future, we have also seen the increase in awareness campaigns held in support to the medical world and its achievements in the past and in the present, which shows that more and more people are now embracing the medical sector, which shall also promote this all hands on board approach. The fifth point is the great application of technology in the medical sector. There's a great rampant increase in the use and discovery of technological devices and it has had its own impact on the medical space. We have seen an increase in the number of testing machines, scanning and imaging machines, life supporting machines, disinfecting machines, and chemicals with very high efficiency, and they need a very short time to achieve their designed work. Having said this, it means that in the future, the practitioners shall also need to be very skilled, and education, not only with medical knowledge, but also should be able to work with the technological equipment. They shall also need to constantly renew their education and likely to need also to attend global conferences so that they can work hand in hand with other global practitioners in other countries. Recently, there has been an introduction of robots to deliver services in areas with high pathogen concentration, for example, in the COVID-19 wards or in the TB wards, with some also being internet controlled to perform surgeries on patients which are in different locations where the practitioners are not physically present. This trend is also proving to be useful, and it is also increasing the efficiency and the rate of success of surgeries. Therefore, it shall be much more used in the future. The sixth point is specialization. In a bid to have an intensive form of medicine, the medical sector has seen the emergence of a specialization era whereby we have practitioners that treat and do study exclusively on certain organs or part of the human body, or others that are of that nature, like the study of pathogens, infectious diseases, psychology, etc. This has contributed largely to the achievements made in the medical field, with the world embracing new forms of diet, energy, and lifestyle, and also in the strengthening of the digital age. Diseases and medical conditions tend to shift towards a certain direction. Study shows that lifestyle-related diseases like obesity, heart diseases, eye diseases, diabetes, cancer, STDs, depression, among others, have largely increased and more so in the future. This means that specialists who are in those areas shall become more relevant than others in the future. The divide and study idea also shall provide quick solutions in the case of new forms of diseases or those that spread quickly or in a special way. We are also going to see the rise in the demand of general medical practitioners, radiologists, pediatricians, ophthalmologists, sport medicine and rehabilitation practitioners, oncologists, psychologists, dermatologists, emergency medicine practitioners, gastroenterologists, cardiologists, neurologists, among others. So in conclusion, we have seen that there is a great change of operation expected in the future in medicine. However, study shows that more brain power shall also be needed in this sector, as we are likely to have more frequent pandemics and epidemics, and new forms of medical conditions shall also emerge. In the future, we are also likely to have microbiological wars, which shall need the medical sector to stand high and defend the human race. It is true that a lot of work shall be done digitally through the use of artificial methods and technological equipment, but that does not mean that the need for medical practitioners shall decrease, but rather shall increase, and technology shall just work for the perfection of the practitioner's work. The demand of technology-related operations shall also increase in the medical sector, among other many related careers. The effectiveness of medicine shall also increase greatly, but it shall face a lot of tests which require fast and effective response. We are also going to see the application of medicine in the negative direction, like the increase in murder cases, which are medically related, unjustified abortions, use of pathogens to terrorize and to make war, use of psychology to promote criminality, and also the promotion of moral decay. This shall need governments and authorities to be well prepared to regularize such behavior and make medicine work in favor of the human race. PSMS shall also be aware of such information and provide positiveness and value of medicine. Let us mask up Get vaccinated, observe hygiene, eat healthy foods, exercise, and get medical checkups often. The doctors and all medical practitioners are working hard to preserve and uphold your health and mine. Let us support them and take their advice. Until we meet again, stay safe. It's goodbye for now.